And many dental practices across the state, they're preparing to offer some full-range services to patients, at least some of them tomorrow, as Governor and Health Department now allowing them to reopen normal business. And our NBC4 Jason Aubrey shows us what precautions are being taken to try and keep patients safe and talks to a hygienist who says opening just might be a big mistake.
After decades of taking extreme measures to prevent the spread of deadly diseases like Hep C or HIV, dental offices have had an opportunity now to take a look at COVID-19 for the past 6 weeks. And many of them feel comfortable taking that on as well. Dr. Mindy Price is doing everything she can to keep her patients safe.
We're requiring that all parents and kids wear masks at all times. We're taking their temperature right when they walk in the door.
While Dr. Price feels comfortable restarting full services Friday, not everyone agrees.
It was my daughter sitting in that chair. You know, how comfortable would I be treating her at this moment in time? And I wouldn't.
Her concern is over creating aerosols while working on a patient who may be a carrier of COVID-19. Most dental aerosols are called droplet nuclei and can float in the air for up to 2 hours. Another respiratory disease, tuberculosis, can be carried on droplet nuclei, and that's why patients with it are not treated in dental offices.
We do know about tuberculosis is it's deadly, it's scary, and that's how it travels. So I think it should be taken seriously.
The World Health Organization says COVID-19 is normally carried on larger particles that don't float on the air, but it may be possible to spread it in specific settings that generate aerosols. Bianca says offices do need to reopen soon, but more precautions like securing air evacuation systems to clear the air need to be taken. In the meantime, dentists like Mindy's father, Dr. Sidney Price, say with no end to the pandemic in sight, we may have to simply move forward.
The risk of the virus is still a small percentage of the population, but the risk of the dental disease is a much higher percentage of the population.
And not all dental offices will be prepared to open tomorrow. Some of them will not have the PPE they need in order to safely handle these procedures. Local for you in Columbus, Jason Aubrey, NBC4.